invite all our guests to kindly settle down. Our program will begin in 2 minutes. Thank you. Once again, may we invite all our guests to kindly settle down. We will begin the program in 2 minutes. Thank you. Let us all rise and begin our ceremonies with the singing of the Philippine National Anthem, followed by the National Anthem of the United States of America.
Bawat buhay mahalaga.
now be seated. Today, we celebrate our commitment as partners with our shared journey towards building a healthier nation. Please welcome the representatives of USAID's health projects that work together for a healthy Pilipinas. Breakthrough Action. COVID-19 and IDDS. Protect Health. Reach Health. TB Innovations. Renew Health. TB Innovations. TB Platforms. Now that we have all gathered, let our festivities begin.
sa iyong damdamin ipamalas ang angking galing. Tumayong buong tapang harapin ng buhay at kapin ang tagumpay.
Tulungan ang kapwa at bigyang halaga, huwag hatakin ng pababa. Isipin huwag sana ang sarili lang, pakisama bayanihan. Subukan nating isulong at ligawan ng magandang bukas. Ikaw at ako magkasama tayo sa lupain ng kinabukasan.
Good morning, everyone, all our distinguished guest partners and stakeholders. Welcome to PADAYON-The DOH USAID shared journey towards a healthy Pilipinas. And what an energetic start to the day. I hope you're all feeling festive and healthy this morning. How's everybody? I see a lot of smiling faces very early. Thank you for being here today. I'm Mitzi Borromeo, and it is a pleasure and privilege to be your host this morning, celebrating with you all. I'm very excited to celebrate here with you today, marking this historic event, the achievements of USAID's health projects in collaboration, of course, with the Department of Health and our partners present here, all of you. These projects helped in intensifying and accelerating efforts towards strengthening health systems, promoting positive social norms and behaviors, and improving the quality of primary health care in the country. Very essential. First of all, of course, we would like to express our gratitude as we acknowledge the presence and support of various government agencies, LGUs, and organizations who are here with us today. We have Dr. Teodoro Herbosa, Secretary of Health. Mayor Joy Belmonte, Mayor of Quezon City. Mayor Remedios Petile of Palo Leyte. Mayor Gina Merillo of Tanawan. We would also like to welcome our guests of honor from USAID, Dr. Atul Gawande, Assistant Administrator for Global Health. Rebecca Eubanks, Deputy Mission Director, USAID, Philippines and Mongolia. Andrea Halverson, Director for Office of Health. Dr. Bama Atrea, and Dr. Yolanda Oliveros. And of course, to all of you, our distinguished guests, stakeholders, and partners, your presence truly means a lot. The achievements that we are celebrating today would not have been possible without your support. So today, we recognize the outstanding achievements of USAID's health projects in partnership with the Department of Health and all partners who are present here. As the projects reach their conclusion, we remain steadfast in our commitment to continue to promote positive social norms and healthy behaviors and deliver quality health care to Filipinos everywhere, every time as we work towards a healthy Pilipinas. We have a very, very special guest to officially welcome you all this morning. Please welcome the City Mayor of Quezon City, Honorable Maria Josefina Joy Belmonte.
Thank you very much to Mitzi. I'd like to greet this morning the Honorable Teodoro Herbosa, DOH Secretary, finally. Dr. Atul Gawande, Assistant Administrator of Global Health, sir. Dr. Bama Atrea, Deputy Assistant Administrator for Inclusive Growth, Partnership, and Innovation, ma'am. Ms. Rebecca Eubanks, USAID Deputy Mission Director, ma'am. We have the Honorable Remedios Petilla, Mayor of Palo Leyte, with us today. The Honorable Gina Merillo, Mayor of Tanawan Leyte, ma'am. Ms. Andrea Halverson, United States Agency for International Development, ma'am. Dr. Yolanda Oliveros, ma'am, United States Agency for International Development. We have the Regional DOH NCR Director Rio Magpantay, sir. Undersecretary Enrique Tayag, sir. Engineer Rene Timbang. Assistant Secretary Maria Belen Angelita Matibag of the Dangerous Drugs Board. Assistant Secretary Dexter Galban of the DepEd. Assistant Secretary Lilian De Leon of the DILG. From the UNODC, Daniele Marchesi, sir. And from the WHO, Yui Sekitani. And I'm sure there were hundreds of very, very important persons with us today. I'm sorry I could not acknowledge each one of you, but to all of the government officials who are here, distinguished guests, ladies and gentlemen, and those of diverse genders, good morning, everyone. It is my honor and privilege to welcome you all to our beloved city. It is also a great pleasure to be hosting this culminating activity entitled PADAYON, the DOH USAID Shared Journey Towards a Healthy Pilipinas, as we commemorate Quezon City's 85th foundation celebration this year. Quezon City has proven to be a vast and teeming city with a steadily increasing income and occupation of about 1/4 of Metro Manila's total land area. It now serves as the Philippines, or one of the Philippines' center of government, where the legislature and other significant government offices are located. All of these are reminiscent of the same noble dream that brought forth the creation of our city and its continuous collaboration with reputable organizations. For more than 60 years, the U.S. Agency for International Development has been working to assist the Department of Health in intensifying and accelerating efforts towards strengthening health systems, promoting positive social norms and behaviors, and improving the quality of primary health care. Today, we celebrate the shared milestones of the indefatigable joint efforts of USAID and DOH in the advancement of quality healthcare delivery and innovative reforms through the different health programs in this morning's formal culmination activity. The Quezon City government is with you every step of the way in support of the various health programs that forms part of our 14-point agenda, as health is a vital component of the city's social and economic development. The primary objective of this morning's program is to recognize the achievements, impact, and sustainability of the USAID health projects with various stakeholders, including implementing partners, staff, beneficiaries, local partners, government officials, and donors. Specifically, this activity aims to present USAID's overall key accomplishments and results, and how these brought impactful changes in the lives of target beneficiaries in the country. Recognize the efforts and initiatives of USAID, DOH, and LGUs in the country's health landscape, and conduct ceremonial turnover of knowledge products, tools, and technical packages to the Philippine government. By and large, these contribute to enhancing the overall health landscape within the country, particularly in improving health leadership and governance, training healthcare workers, strengthening public financial management, improving supply chain management, refining health information systems, and expanding coverage of quality health services by strengthening essential supportive and cross-cutting health interventions at the regional, local government, and community levels. This event is pivotal in providing an opportunity for DOH, USAID, and stakeholders to gather feedback, share knowledge, ensure accountability, and set the stage for the continued efforts to enhance the effectiveness and significance of future health interventions. USAID has worked with the Philippine government and local organizations to achieve common goals and to build a more progressive, resilient, safer, and a healthier nation for all Filipinos. We are all grateful for the assistance that USAID has provided that bolsters the programs of HIV, family planning, tuberculosis, community-based drug rehabilitation, COVID-19, mental health, and other supply chain health systems. This partnership further strengthened our health scheme by intensifying the services of each program as to governance, patients' access, identification, treatment, prevention, and control to reach the crucial or vital population of our country and our cities. With our collective efforts, we can make substantial progress in further enhancing the health burdens in our city and our country. Your journey with us will always be fruitful, and we are looking for another endeavor or other endeavors and collaboration with you. May we always join our hands and hearts in building a better tomorrow for our nation. Padayon, let us carry on, as it is imperative that we consider our actions today as our investment for the future of our families, our city, and our country. Again, thank you all and welcome to Quezon City.
Thank you very much for that warm welcome, Mayor Joy Belmonte. Indeed, this is an investment in the future. And speaking of investments, I'd like to congratulate Mayor Joy Belmonte and the entire QC LGU for the recent recognitions for all your accomplishments, including Mayor Joy Belmonte was recognized as the most outstanding business-friendly mayor for her successful projects. Congratulations, Mayor. Quezon City indeed is a great example for the Philippines. Thanks for all you do. Over the years, USAID has continuously worked closely with the Department of Health in enhancing the overall health landscape within the country, particularly in building health leadership, training healthcare workers, strengthening public financial management, improving supply chain management, refining health information systems, and expanding coverage of quality health services by providing essential and cross-cutting health interventions at all levels. Today, we recognize the contributions of 9 USAID projects whose initiatives successfully contributed to the country's health landscape. Now it's time to shine the spotlight on the efforts and achievements of these outstanding projects. Let's watch this. So that video was just a very brief highlight of all the amazing work that's been done. Just a quick overview, really, of how amazing all the work you've done, all the work has been, and how much more we can achieve together through the continued support of partners who share the same vision for creating a healthy nation for all. USAID is committed to its continued support for the country's efforts towards the shared journey for a healthy Pilipinas through its partnership with the Department of Health. In line with this, we will be hearing more from a very special guest speaker who will be addressing us today. To give our distinguished guest a proper introduction, may we call on the Deputy Mission Director of USAID Philippines and Mongolia, Ms. Rebecca Eubank.
Magandang umaga sa inyong lahat. I am honored to join you today to celebrate the culmination of USAID health projects and to introduce our keynote speaker. Dr. Atul Gawande is USAID's Assistant Administrator for Global Health, where he oversees a bureau that manages over $4 billion and over 900 staff committed to advancing equitable delivery of public health approaches around the world. Prior to joining the Biden-Harris administration, he was a practicing surgeon at Brigham and Women's Hospital and a professor at Harvard Medical School and the Harvard T.H. Chan School of Public Health. Many of you may recognize Dr. Gawande from his renowned work as an author. He is truly skilled at storytelling of the global public health. Atul was a longtime staff writer for the New Yorker magazine and has written 4 New York Times best-selling books: Complications, Better, The Checklist Manifesto, and Being Mortal. Dr. Gawande is a member of the National Academy of Medicine. He is the winner of the MacArthur Fellowship, 2 National Magazine Awards, Academy Health's Impact Award for highest research impact on healthcare, and the Lewis Thomas Award for writing about science. Please join me in welcoming Dr. Atul Gawande.
What a great start to the morning. Thank you, Mayor, for welcoming us here and hosting us here and providing such a great introduction. Thank you to the other mayors who have joined us. Thank you to Ted Herboza. I have to tell, and most of all, thank you to all the partners here who are gathered to celebrate the culmination of another phase of work that has had tremendous impact. I have to start with Ted. Ted Herboza and I are both surgeons. 20 years ago, we began work together as surgeons on how do we make surgery safer around the world. And a U.S.-Filipino partnership started around the principle that we could try to change surgery practice everywhere. We tested a simple checklist that aimed to address the low quality of care in surgery by having a simple 2-minute check, making sure that the most critical items that kill people in operating rooms were not missed. The results in Manila at Philippine General Hospital and 7 other cities around the world, including Seattle and London to Tanzania to India, was a 47% reduction in death, an extraordinary impact. And the result has now spread to standard of care in more than 80% of the operating rooms in the world. Ted then went on to become Undersecretary of Health. And he showed me there is a bigger impact that can be had, that we can go as surgeons to imagine embracing having impact on health systems and on public health at an extraordinary scale. So I had to follow him and come to USAID and get to lead global health and renew our own personal partnership by joining a partnership that has been there for decades. Decades. This is a culmination of the work of the last 5 years, but it is going to be work that continues for decades onward too. I want to point out some of the work that has been accomplished, and I won't be able to call out all of it, but it gives you a flavor of the impact that is possible. My job at USAID is to lead our foreign assistance in global health. And there are two purposes behind this. Number one is to stop diseases from spreading, killer diseases from spreading, for the security of us all, to the benefit of our countries and the world. But the second is also to stop premature death, deaths in children and deaths before the age of 50, because we've made the discoveries that can make those deaths extremely uncommon, but they are all too common. And because they're also critical to the success of our societies. The young and the middle-aged are the people who generate our leadership, generate our economic growth, generate our stability and peace. And so for those two reasons, we support and aim to partner with countries across the world. But the Philippines is a special partnership because of our close relationships and because of the opportunities for the learning together, the openness that we share to taking on difficult problems, acknowledging what doesn't work, what could be better in our own work, in our own countries and the ways we work, and in our and together in the world and shaping the region and beyond. And so I'll point out a few examples of what's been milestones and accomplishments from 2018 to 2024. There is no better example than our work together in tuberculosis. Tuberculosis is the biggest infectious disease killer in the world. More than 1 billion human beings have been killed by tuberculosis in history, and it still continues to this day. Now, the challenge is that we know what works in tuberculosis to stop it completely, to eliminate it in countries around the world. What eliminated it in the United States, what eliminated it in much of Europe as a major public health problem was that TB has to be identified before it makes people sick. Much of the time it is latent, it's sitting in people's bodies, not recognized. And there are simple ways to address it by screening people with X-ray, by testing them, and then treating the people who have the disease, then following up and finding the people they live with, their contacts, and making sure they get preventive solutions. That's what worked in the 1950s, 1960s, 1970s in a place like the United States. But it was extremely expensive, complicated, taking medications for months on end, and the testing took days to sometimes more than a week. Now today, in our innovative work together, we're screening with digital X-rays that are portable and can be brought into the community at low cost, that can be read even if there are not enough radiologists to read all of them by having an artificial intelligence reader that's now been approved in the Philippines, where we've innovated together about bringing this tool out into the world and then introducing the simple way that a chest X-ray connected to a laptop computer could give you a result within minutes. And then immediately, within minutes, going to get a molecular test instead of needing to do a culture or a skin test that would take you days to get results. That set of work done with the partners around the TB strategy involved setting up molecular testing systems like the Gene Expert system that enabled immediate results, but was costly. In the last few years, with the Philippine Private Sector Diagnostics Consortium, the cost of the Gene Expert test was reduced by 70% for private sector facilities, getting them the kind of benefits the public sector facilities have from our global drug facility that has also lowered the cost of this test dramatically. And that meant that more than 750,000 people with TB have been identified and linked to treatment who would never have been identified, helping start to bring it under control. The next steps are to provide the treatments, and through our USAID support, we have achieved a partnership that in the 3 TB highest burden regions in the Philippines have achieved a 92% treatment coverage rate, which is a 32% increase from the baseline of 60% in 2017. So that's meant not only are we detecting TB, we are saving lives at large scale. Our next challenge is to reduce the burden of TB by being able to trace the families that are connected to these people with TB and get more of them on preventive treatment. And I know that the Department of Health, under Secretary Herbosa, has made that a major, major commitment. USAID support has gone to the Department of Health and the TB National Coordinating Committee to develop this Philippine action plan, acceleration action plan for TB for 2023 through 2035 as the blueprint that is the right solution for a multi-sectoral set of actions that will end TB as a major public health killer in the Philippines and will provide an example to the entire region. That's just one of the things that the people in this room have enabled and been part of. There was a second event when COVID came through, which became the biggest killer in the world, surpassing even TB. We had the first global reduction in life expectancy in more than 70 years because of COVID. And many of you in this room, the world is tired of talking about COVID, but you in this room were really tired. You rolled up sleeves, you came together when we had no treatments, you worked on getting diagnostics out into the community. When we needed oxygen, you helped build oxygen systems with USAID support. When we got vaccines, the United States provided 33 million vaccines, and you all supported the delivery, the change in behavior, the fighting away of disinformation to make sure that the entire country received the vaccines that were needed to help support the Department of Health in this incredible catastrophe for the country that we are still recovering from. Another catastrophe for the country has been drug addiction, and USAID has been proud to work with you to set up evidence-based CBDR, community-based drug rehabilitation services in 22 local government units, including here in Quezon City. And that has developed evidence-based treatment protocols that apply to the low and moderate risk users adopted by the Dangerous Drugs Board nationwide. These are the low-level users who are currently filling the jails and wasting opportunity, lives, when they could be gotten back to the community and contribute and return to society. USAID has also developed gender-sensitive treatment approaches for women and children who are using drugs. Along with this has been a set of mental health work that we've supported for the development of the first mental health applications, the LUSO ISIP application designed for Filipinos by Filipinos. And we are working together with the Department of Health to integrate mental health into primary care services. The drug crisis has driven innovation where we are now understanding from your experience in Philippines, from you as partners, what you're creating, how to enable mental health at much larger scale. We are still early in the journey of learning how to do that, but it is critical that we have your partnership and your commitment to learning how. And then along the way, it's not been enough to have just these projects to make progress in saving lives now. We want to work with you to leave behind a stronger health system that works for everyone across their life course along the way. And so we have supported assistance, technical assistance to PhilHealth to strengthen their benefit delivery and design, give them the tools, the analyses, the global expertise that they want and need in order to strengthen design of their work. We have supported their ability to leverage $354 million in COVID-19 benefits paid out. And then the development of Consulta as primary care financing for the core scaffolding on which longer life and better health is actually created, primary care. That work, assisting Consulta in its design and in project sites, facilitated registration of nearly 1.1 million beneficiaries so far and 300,000 first patient encounters. Consulta is still just starting, but it's the basis for a stronger, permanent future. That's why USAID has supported the Department of Health, PhilHealth, and its project sites to develop more than 300 technical reports required that contributed to 21 national and local policies, strategic papers, and to plans so that life-saving medicines, medical supplies, and essential primary health services are continuously available to the Filipino community. All of this to say is, you're on a journey. The journey is towards long life, better health, and we're on that journey with you. We are here in support. We're here to learn and take your best findings, not only elsewhere, but to the United States too. So I want to thank you for all that you've done in the course of this body of work, stretching across a much wider range of areas than even the ones I just spoke about. And just to say thank you. What an incredible opportunity and what a great way to celebrate the culmination of this work. Thank you.
Thank you very much, Dr. Atul Gawande, for painting a very beautiful picture of this journey together, as you said, highlighting the power of partnerships and progress towards saving lives and improving health systems. And of course, thank you for your contributions in research and public health. It's great to have you here. The impact of these projects is best seen in how they have improved health services and in turn improved people's lives. And now it's time for us to witness the culmination of our efforts as each project presents a symbolic representation of their work and showcases their accomplishments for the past 5 years. For COVID-19, starting with breakthrough action.
On behalf of the USAID Breakthrough Action Project, implemented by the Johns Hopkins Center for Communication Programs, we are presenting a shield, a symbol of defense and protection, to represent our work on COVID-19. Using social and behavior change, our work focused on reducing the impact of the virus, increasing vaccination uptake, and improving risk communication and community engagement.
Epidemic COVID-19 and IDDS.
The USAID meeting targets and maintaining epidemic control, or in short, EPIC project symbol, is representing the project's key technical areas in COVID-19 emergency response, such as clinical case management, strengthened oxygen ecosystem, and mental health support for healthcare workers. The project has built a stronger and more resilient health workforce and an adaptive health system that is prepared to prevent and respond effectively to future epidemics and other emerging infectious diseases. We dedicated our success to thousands of healthcare workers and other frontline workers who saved millions of lives during the pandemic. The USAID Infectious Disease Detection and Surveillance, IDDS, projects shares this symbol of COVID-19 specimen transport and testing to demonstrate the importance of access to timely COVID-19 testing. IDDS increased the access to COVID-19 testing and reduced dramatically the turnaround time to release the testing results. Through building the capacity of frontline healthcare workers for safe collection, handling, packaging, and transportation of COVID-19 specimens, ensuring dedicated streamlined specimen transportation means, and supporting laboratories to be well equipped to respond to demand for COVID-19 testing.
Reach Health.
On behalf of the USAID Reach Health project implemented by RTI International, we present the symbol of the mobile vacuna jeepney supported by USAID in partnership with the Department of Health and the city health offices of Caloocan, Manila, and Quezon City. Our core work on family planning and reproductive health has been complemented with the COVID-19 technical assistance. Thus, in collaboration with the LGUs and national government agencies, USAID Reach Health project accomplished the following. We trained more than 4,000 barangay health emergency responders. We facilitated rapid testing of more than 500,000 Filipinos. And we reached almost 16 million Filipinos with gender-based violence awareness messages, encouraging victim survivors to seek help. We procured and distributed personal protective equipment worth over $500,000 to health facilities nationwide.
For health systems, MTAPs.
On behalf of USAID's Medicines, Technologies, and Pharmaceutical Services program, implemented by Management Sciences for Health, we are presenting the Warehouse Operation Manual, which is a blueprint for the country's health commodity supply chain operations to bring life-saving products to every Filipinos. It is also foundation in digitizing the country's supply chain. Some of the major accomplishments for MTAPs, developing a long-term supply chain strategy and also supporting the development of close to 10 policies, digitizing the supply chain through electronic logistics management information, which visualize supply chain data in real time. We are not just working on product availability. MTAPs also works with pharmacovigilance, which is focusing on patient safety.
Protect Health.
On behalf of USAID's Protect Health, implemented by Palladium, we are presenting a symbol in the form of a check addressed to the Filipino people. Our work focused on healthcare financing, specifically strengthening PhilHealth benefit delivery, improving DOH budget performance, and ensuring sustainability of LGU financing.
For mental health and community drug rehabilitation, we have Renew Health.
Renew Health's shared journey towards health-driven, evidence-based, and compassionate community-based drug rehabilitation is represented by the symbol, showing clients, their families, and community members working together to prevent and help people recover from substance abuse. We have seen that done the right way, CBDR works, and we provide models and tools on how this can be scaled up in the Philippines.
Tuberculosis, TB Innovations.
The USAID TB Innovations and Health System Strengthening Project is about using the power of the triads of evidence-based technology to early detect persons affected with TB, science of adopting convenient and effective treatment regimens, and the art of creating supportive social norm to address stigma and the changing health-seeking behaviors for early treatment initiation and adherence. This is designed and implemented in collaborative approach within an effective multi-sectoral platform supported by good governance and accountability to address social determinants of health with an eye on integrating TB services in a solid primary care benefit package for all.
TB Platforms.
On behalf of the USAID's TB Platforms for Sustainable Detection, Care and Treatment project implemented by University Research Co., URC, we present the Blooming Lungs, a symbol signifying USAID's TB Platforms' multifaceted approach that goes beyond the creation and implementation of best practice interventions and processes for TB control and prevention, but also contributes to the flourishing health ecosystem of the country and, most importantly, to the healthy lungs of Filipino families and communities. Our work focused on the improvement of healthy behaviors, patient-centered, drug-sensitive, and drug-resistant TB treatment, and local health systems' capacity to deliver quality services.
may we call once again Deputy Mission Director of USAID Philippines and Mongolia, Ms. Rebecca Eubanks, to please join us on stage to hand over the project symbols. May we also call on our Secretary of Health, Dr. Teodoro Herbosa, together with our local chief executives, Mayor Joy Belmonte, Mayor Remedios Petilla, Mayor Gina Merillo, to kindly join Ms. Rebecca Eubanks on stage for the handover.
What incredible work. Congratulations to all of our partners. So with these symbols of our 9 projects, I am pleased to pass them along with USAID's commitment to aid the Department of Health and the Philippine government on a successful journey to a healthy Pilipinas.
I hereby receive the symbols with my sincere thanks to USAID and its implementing partners for their contributions in our journey for a healthier Bagong Pilipinas.
Partnership continue to prosper, and may it help us stay committed to our mission to create a healthier future for our nation. Padayon. Let's commemorate this moment with a photo souvenir. Next, we will have a photo together with representatives of USAID's implementing partners. finally, may we call on the rest of our partners for a commemorative photo. Thank you very much. Thank you very much. You may return to your seats. Okay, we have a few more last photos. Thank you, everyone. Once again, we thank Secretary Arbosa, Mayor Joy Belmonte, Mayor Remedios Petilla, Mayor Gina Merillo, and our local chief executives, Ms. Rebecca Eubanks, and all our implementing partners. Thank you for taking time to pose for our photos. Please return to your seats. All right, so we took the obligatory photos, but I hope you all still stay because we have another surprise for you. We're not done yet. We still have a few things to bring you, so please stay in your seats. Our commitment towards our shared journey to a healthier nation continues. And now, we're about to witness the impact of these projects that we are recognizing today. Let's hear it from the project's beneficiaries. Watch this.
It really boosts my self. From there, nakakuha ko ng strength sa group na yun para lumaban sa sakit ko na TB.
Papasalamat ako dahil doon sa suportang ibinibigay nila sa mga centers natin dahil malaking tulong na nagbibigay sila ng support para mabigay sa amin yung gamot at tamang information na kailangan namin sa gamutan.
Our multi-sectoral and innovative initiatives in addressing this critical concern. Today's event is one such embodiment of these multi-sectoral efforts. Through the leadership of our partners and local counterparts, we are able to deliver not only life-saving services, but also improve literacy for prevention and health promotion.
I'm very thankful to USAID for their really hands-on approach, and also the patients, and all those extra miles, so to speak.
PBDR, community-based drug rehabilitation program, is very important in our fight against drugs. We can't just fight the supply side, but we need to fight the demand side. And the goal of CBDR to have an intervention at the demand side to reduce the demand for illegal drugs and to help the lives of these individual people so that they can recover from drug addiction or drug use.
I would like to thank the USAID for their continuous support for years here in Negros Oriental. The USAID has been an indispensable partner ever since from the beginning for their continuous support.
Addressing the healthcare needs of the Bangsamoro constituents natin. So, by not only providing essential supplies katulad ng oxygen, commodities to the hospitals, but also offering crucial technical assistance.
I'd like to extend our sincere thanks to USAID. We were able to bring the project to the communities and that we somehow help the Provincial Health Office, the Ministry of Health, in ensuring that the program implemented by USAID made impact to the lives of the people.
I would like to express my sincerest gratitude for your support and trust in our institution's thrust to provide accurate and timely COVID-19 diagnostic services to our fellow countrymen. In a time where working together is important more than ever in order to overcome this pandemic, it is reassuring that we have institutions like the USAID that share in our vision to provide critical services during this time of incredible need.
So this is a nice venture, a welcome venture for all of us at the province, particularly the health sector. We are very, very happy with this partnership with USAID.
Our unwavering goal is to ensure that all Filipinos have access to safe, affordable, and high-quality healthcare.
The partnership between Peace Corps and USAID has resulted in the training of 12 Peace Corps volunteers and their local counterparts who trained 160 youth leaders that facilitated 70-day camps reaching more than 5,000 youth in 15 Peace Corps partner communities.
I would like to thank USAID for including us in this very important and significant project because this will make diagnosis of TB easier.
Truly, we are thankful for this collaboration, and please know that all your contributions will be remembered, and we are always open to future collaboration with you again if opportunities arises.
All right, very inspiring messages there. It really gets to the heart of the matter where all your work really goes to. So thank you for all you do. These 9 projects brought impactful changes, as we saw in the video, in the lives of intended beneficiaries in the country and in the country's health landscape. We are proud to bear witness to these projects and showcase the commitment of DOH and USAID in putting the health and well-being of Filipinos first and strengthening our healthcare system. So please, I think you all deserve a round of applause. Let's give all of you a round of applause. Thank you, as if we haven't been clapping enough. So we've seen the positive impacts of our combined efforts and the lives that have changed because of our shared commitment. So now we will hear a message of hope for a better healthcare system for the future generations of Filipinos. And we have a very special guest representing the youth. Please welcome Kian Petalio.
You can do it, Kian.
He's a bit shy, so please, let's cheer him on. Come on, Kian. Yay, thank you, Kian. It's very brave to be here today. Okay lang yan, kaya yan, Kian.
Ano tayo?
Ako po si Kian, 8 years old, nakatira sa Santa Ana, Manila. Isa ako sa libo-libong nagtagumpay laban sa sakit na tuberculosis kasama ng aking kapatid na 5 taong gulang. Bagamat sa lahat ng aming pamumuhay, ako ay lubos na nagpapasalamat sa taos pusong pag-aaruga at pagmamahal na aking natanggap mula sa aking pamilya, sa ating pamahalaan, USAID at TB People upang ang sakit sa TB ay mapagtagumpayan sa aking paglalakbay bilang isang kabataan. Ako ay nabigyan ng pag-asa na magpatuloy at mangarap muli. Ako ay labis na umaasa na hindi lamang ako kung hindi libo-libo pang kagaya ko ang makatatanggap na serbisyong pangkalusugan na maganda, makatao. Mataas ang kalidad at nararapat para sa mga kapwa ko kabataang Pilipino. Muli, ako po si Kian at ito ang aking mensahe ng pag-asa. Maraming salamat po.
Maraming salamat, Kian. Thank you. Beautiful message. Maraming salamat, Kian. So, picture muna tayo. So for those of you who may not have understood, he and his brother are survivors of tuberculosis. Thanks to your help, he is able to carry on Padayon because of the help that you have given him. So he has the energy to move forward. Salamat, Kian. Thank you again. So again, he also sent his message that he may have been given hope, but this represents millions of other children who are also in need of your help and are grateful for the help that you are bringing. So once again, thank you to all of you. So this is a beautiful message from Kian that reminds us all to continue to serve as the remainder that in the remainder of our time, as we are the keepers of the hopes of the future generation. So the word padayon, this is a word to remind us to carry on. With stories like Kian's, we are reminded of our commitment to continue to look for more innovative and evidence-based solutions and to foster existing partnerships and build new ones that will help us improve access to and quality of health services for every Filipino today. And, of course, bring hope for a better future for the next generation. The road to building a healthier nation would not be possible without the support of like-minded partners and the participation of the communities we serve. And now, to share with us some final words, may we call on stage our final speaker for this morning, the person in charge of making sure that we are all on our way to a healthy Pilipinas. Ladies and gentlemen, please welcome our Secretary of Health, Dr. Teodoro Herbosa.
Thank you very much, Mitzi, and to everyone. Really very emotional morning with all the help of USAID. Let me first recognize the mayor of my city, where I live, Maria Josefina Joy Belmonte. She has been an avid health supporter all the way back when I was an undersecretary 10 years ago. Remember our projects, lactating rooms in government offices, and many, many more. I also like to recognize, of course, my good friend, Dr. Atul Gawande, USAID Assistant Administrator for Global Health. I'll recognize other dignitaries. I have the Assistant Secretary for the Department of Education, Dr. Dexter Galban. Inaanak ko sa kasal yan, but we've always partnered along with our advocacies against the use of cigarette, nicotine, and vape among our youth. And of course, we also have our Assistant Secretary for our partner in delivering health and primary care to all the communities, the Assistant Secretary of the Department of Interior and Local Government, Lilian De Leon. Thank you so much for your partnership. And of course, I'd like to recognize the different mayors from the different municipalities and towns of Leyte, and of course, our Deputy Assistant Administrator for Inclusive Growth in USAID Partnerships and Innovation Bureau, Dr. Bama Artea. The Deputy Mission Director of USAID, Rebecca, Rebecca. Thank you so much. Ms. Rebecca. and all other USAID colleagues. Maybe I'll start the story that I was once a USAID regional coordinator. So I'm part of you. That was the program called PEER, Program for Enhancement of Emergency Response, because of my field in trauma surgery and disaster medicine. And I coordinated USAID projects in Southeast Asia and South Asia. That was the time that Atul was telling me he's traveling a lot, I think several days. That was the time I wake up in a hotel room and I didn't know which country I was in. But the people who work in the USAID really contribute a lot. And Atul started with a story. I'd like to start with a quote. It's my favorite quote, and I quote this every time I give a lecture in surgery, in leadership, in health system strengthening. And I always end it with this quote. But today, I'm going to begin my talk with this quote. And I start, and I quote, "Better is possible. It does not take genius. It takes diligence. It takes moral clarity. It takes ingenuity. And above all, it takes the willingness to try," unquote. From the book entitled Better, written by Dr. Atul Gawande. Dr. Atul Gawande has been my inspiration ever since I joined. I've been working with WHO. Because of my work in disaster work in the Philippines, the WHO gave me a fellowship to study in Geneva. And I did plenty of work with WHO in several islands for disaster work. And one day, I was called to join a group for a World Safety Challenge, in Global Safety Challenge. And that was where I met our leader at that time, Dr. Atul Gawande. But by the time I met him, I had already read a book which is considered a Bible of surgical residents. The first book that Atul wrote is about complications and why complications in surgical care happen, why death happens. And he asked many intriguing questions that every surgeon would have. And he was a big influence, so it's wrong that I influenced him. He actually influenced me a lot in why I actually do work. But my favorite book is, of course, Better. In Better, he traveled around the world. He went to his home country, India, and looked at interesting, successful efforts to improve primary care with very little. The rural surgeons in India and other practices for outbreak investigation, house-to-house vaccination, and all that stuff that made a difference and an impact in health outcomes. Those books are very interesting. And of course, the Checklist Manifesto, the third book, was the book about that safety checklist, patterned after what you guys actually don't see every time you ride an airplane. The pilot and the engineer has something like a 3-page checklist of 17 items. We implemented that with just a simple checklist, and we decreased mortality in surgical care by a big number. On behalf of the Department of Health, I extend my sincerest gratitude and appreciation to the United States government through the United States Agency for International Development for their steadfast commitment in advancing health in the Philippines. The Department of Health is honored to be a partner of USAID in strengthening health systems, promoting positive social norms and behaviors, and improving the quality of primary health care. The Department of Health genuinely appreciates the USAID for the successful implementation of the following projects through the Development Objective Agreement, Improved Health for the Underserved Filipinos, Protect Health, Reach Health, Renew Health, TB Innovations, TB Platforms, and MTAPs. At this point, I'd like to tell the story also of tuberculosis, because tuberculosis was mentioned to me when the President called me to his office to be appointed as secretary. He asked me why the Philippines is still number 4 in the list of countries with the most number of new cases of TB. And he asked me to solve that problem. Well, we're here in Quezon City. 86 years ago, there was a senator in the Philippine Senate. We're still a Commonwealth. And that senator passed a law. That law created the Philippine Charity Sweepstakes Office. And that Philippine Charity Sweepstakes Office provided the funding for the first TB sanitarium in this country, which is your Quezon Institute And that senator became president of the Philippine Commonwealth, Manuel L. Quezon, which is the father of this city. He planned this whole city, and we're actually in his memorial, the Quezon Memorial Circle. And what is interesting and both sad and tragic is he's our president that died of tuberculosis. He died in the US of tuberculosis. And I tell this story in meetings of tuberculosis. I said, it's 86 years ago. I'm still struggling with a country. I become Secretary of Health of a country with the highest number of new TB cases. And TB in this day and age, Dr. Atul, is treatable. It's easy to diagnose, it's treatable. So what are we doing wrong? And we need to fix this. And I, as a surgical mind, I said, it's a problem that's solvable. It's really solvable. And I do hope we can solve this problem of TB in the Philippines. Our appreciation extends to the knowledge products, tools, innovations, and technical packages provided by USAID, benefiting not only the health sector, but also local government units, and reinforces our journey of the Department of Health and USAID towards a malusog or healthy bagong Pilipinas. And one of those innovations is that ultra-portable X-ray you saw on the video. That ultra-portable X-ray was used by USAID to diagnose latent tuberculosis in many communities, and patients were started on anti-TB therapy because of that ultra-portable X-ray connected to a laptop. You didn't need a radiologist, you didn't need X-ray plates, you didn't need a X-ray room with lead walls. And because of that demonstration, our FDA has approved the use of that ultra-portable X-ray with artificial intelligence in the laptop that diagnoses TB. And I'm sure it will be even more beneficial when we roll out the 83 mobile clinics where I will put these particular X-rays so that it can actually diagnose most of the latent tuberculosis in the different provinces of the Philippines, including Leyte. We thank the USAID for its continued support of health programs in the Philippines, and with your technical assistance, we will be able to act decisively, especially when we implemented COVID-19 from prevention, control campaigns, as well as strengthening emergency response to outbreaks and epidemics. And we want to implement our strategy then for prevention, detection, isolation, and treatment and reintegration strategies for containing any community outbreak. We also work together to roll out COVID-19 vaccination. Our biggest donor for vaccines of COVID-19 was the United States of America. We were able to bring in 190 million doses of COVID-19 vaccine. I think the US provided about 80 million doses of that portfolio approach to COVID-19 vaccination. We also showed how solidarity worked during COVID-19 vaccination with the private sector, the local government, the national government, the civil society. We were even able to achieve the highest vaccination rate in a single day. 1.8 million doses of COVID-19 in a single day, the fourth largest in the country, in the world. That's a record, and you should give a clap to yourselves for doing that. Our work delivers also on the promise and vision of universal health coverage and the sustainable development goals of health, including quality service delivery, healthcare financing, health governance, and health regulation. As we navigate the global health complexities, the Department of Health stands firmly in support of USAID's mission and endeavors. Aligned with the principle of no one gets left behind, we crafted the 8-point action agenda sa Bagong Pilipinas, Bawat Buhay Mahalaga. In the new Philippines, every life is precious, which places every Filipino, every community, every healthcare institution, and every healthcare worker at the center of our actions. Under this administration, I have emphasized the need to make primary care a reality, which demands from us to be more attuned to the realities of every Filipino household, community, keeping in mind that the primacy of the human being. With this in mind, and the current state in the health systems, The health sector will make a pivot, a 180-degree turn from our usual way of thinking. Doing so, I like that the influence of thinking differently is from better. And the pivot is to put more clearly, restore sectoral and organizational equilibrium. It means a change of direction to discard old practices. Our old practice for the past 3 decades was to let the local government units run the primary care units because of the Local Government Act. That's going to change because we said there is nothing in the law that prohibits me from doing better primary care. And we've been talking in the Sofitel Hotel for the past 2 days, discussing the National Ambulatory and Urgent Care Facilities to be built for 28 million poorest by 2028. So we're starting with 28 areas where we can build it, but with the groundswell, I think I will overshoot the 28 because of the interest. Our challenges are not new. They have existed for several years, including TB, but we must develop new approaches and strategies to address these problems, especially in my 8 priority goals. Number 1, immunization. I'd like to again achieve 95% fully immunized child from all vaccine-preventable diseases. Someone from the DOH told me, Dr. Herbosa, that's not possible. Well, that's what he thinks. We did it during the time of Secretary Flabier with national vaccination days and good communication. So I'm saying we're going to do fully immunized child of 95% and remove the Philippines as number 4 country with the highest number of children with 0-dose vaccination. So I'm going to get out of that list. Second, nutrition. We're talking about 27% stunting in the Philippines. I was telling Atul, the economic ministers, the economic secretaries are telling me we will be declared by World Bank, IMF, and all the economic indicators as a high middle income country by 2025, next year. But sad to say, all our health indices are that of a low income country. And I do not take any excuse for that. We have our own difficulties. We are an archipelago. And you saw the logistics and supply chain support that we need to be able to deliver vaccines and medicines to the different islands. But sad to say, nutrition is very simple, and it's something in primary care that can be done easily. Our children, the rate that the National Nutrition Council said in its research is 27%. That's 3 out of 10 Filipino children with stunting. So when they say they don't believe the fact that the Philippines has the lowest IQ in Southeast Asia, I have to counter that because I have the statistics of brain stunting. 3 out of 10 Filipino children. We need to fix that. We need to make that 0 out of 10 children. Number 3, maternal deaths. When I was undersecretary, this was our target, remember? That's why we were building all this maternal support and birthing centers. And at that time, maternal mortality was 154 per 100,000. We were able to decrease it. By the time I left as undersecretary in 2015, it went down to 125 per 100,000. Prior to COVID, it went down to 111, the lowest. We were hoping that it would go down to 50 or below 100. But most recently, it went up again to 144 per 100,000. Then we tried to look into the numbers. What's raising these numbers? Most of the deaths were in children. It was in teenage pregnancies. We're getting Filipinas, age 11 and 12, pregnant. Something's wrong there, Dr. Dex Galban. when children get pregnant, someone has to go to jail. That's rape in this country as well. So we have to fix that. And I met, in one of the teenage clinics we actually put up, I met a 19-year-old who's had 3 children. She was 19. She started getting pregnant when she was 14. But they're all different fathers. So there's a problem as well with that particular. And if we are able to move that needle, I think our maternal mortality ratios will also go down. Number 4, TB. So I know I cannot decrease TB in my term up to 2028, but of course, I can promise that no Filipino should die from tuberculosis. In this modern age, we must be able to diagnose them, detect them, and be able to give them complete therapy. So 0 death from tuberculosis. Attached to the TB is the fact that when we diagnose TB, we also find HIV. So the two, and when we find HIV, we usually find TB. So we're also addressing the problem of HIV in our children. Then there's road safety. This is something I inserted because the people who die from road safety is the young head of family who is able to buy a motorcycle because it's so difficult to ride a jeepney or public transport. He buys a motorcycle and crashes after a night of binging with alcohol, thinking with alcohol he can still balance in 2 wheels. They end up in our emergency department with head injury, and they eventually die. So this is a big factor. A young male, head of family, probably a father of 2 children, impoverizes a big social impact in terms of prevention. And it's so easy, wearing the helmet, providing motorcycle lanes. The things to fix road safety are even easier. Then there's non-communicable disease, number 6. And I'm focusing on 2 diseases, hypertension and diabetes. In the Philippines, mahilig tayo sa maalat, sausawan, patis, toyo, and that's the cause of our hypertension. The second cause is actually diabetes. Diabetes is the other high incidence non-communicable disease. In fact, many congressmen come to me asking for dialysis centers. 70 to 80% of our kidney and stage renal disease come from uncontrolled diabetes. So the solution is simple. It's not more dialysis centers. It's preventing people from getting diabetes. And if they get diabetes, make sure they have the diabetic meds and insulin to actually prevent their kidneys from eventually going to end-stage renal disease. Number 7 is cancer. Our life expectancy is increasing, and of course, cancer is also increasing. But you see, the problem with cancer is that we've shifted to a program on chemotherapeutic agents. The congressmen come to me again because the patients go to them on stage 3, stage 4 cancer, being prescribed very expensive drugs. And Atul and I are surgeons. Only 1% of breast cancer in this country is stage 1 at the time of diagnosis. That's very low. Most countries take 30%. And we need to change that. How do you change that? By offering free mammograms to women 40 years old and above. If we're able to do that, we can detect cancer early and providing the surgical expertise to be able to provide surgical extirpation. So the treatment is not chemotherapy for cancer. It's early detection and early removal by surgery. Lastly, digitalization. From asset management to mental health, we've been using digitalization. I think this is our ticket to making a healthier Filipinas in the new era. To provide a clearer manifestation of effective delivery of primary care, the Department of Health is setting up a network of 28 national ambulatory and urgent care facilities. Polyclinics is how other countries called it, by 2028, with the intention to address the healthcare needs of 28 million poorest Filipinos by 2028. As a matter of fact, as of this moment, the health sector leaders are participating in the National Health Sector meeting, further elaborating the concept of the National Ambulatory and Urgent Care Facilities. Our aspirations are high, and in order to drive this transformation changes in our country's health sector, we count on your assistance, the USAID, together with other international development partners and key implementers. We look forward to continuing collaborative efforts and maintaining and achieving even greater milestones in the years ahead. To end, the Department of Health is committed to our partnership with the USAID as we continue to work towards a healthy Pilipinas. Dahil sa bagong Pilipinas, bawat buhay mahalaga. Maraming salamat, mabuhay ang USAID.
Thank you very much, Secretary Ted Herbosa. You outlined very clearly there the great work ahead of us good map there to start the new year. So a lot of prospects for more collaboration. Thank you for that. Well, before we officially close our program, I know you've all taken so many photos already, but we have to take more commemorative photos. So may we once again invite our guests from USAID here back on stage, together with our mayors, Mayor Joy Belmonte, Mayor Remedios Petilla, and Mayor Gina Murillo. We ask you to come on stage again, as we'll have a few more photos before we close the program. For the first batch, we would like to call on the department agencies, our representatives from DOH, CHD, DepEd, DDB, DILG, CPP, PhilHealth, and FDA. So we'll be having our last round of photos before we close the program. We may ask you to come forward, please. Okay, for the second batch, can we call representatives from our development partners, WHO, Pilipinas Shell, PBSP, UNODC, and UNAIDS. We'll move on to the second batch of photos, please. Once again, representatives from WHO, UNODC, Pilipinas Shell, PBSP, and UNAIDS. We also call on DOH CHD. DOH CHD representative, please. May we ask you to come forward for a photo? DOH CHD representatives to join the photo, please. Next, we call on the implementing partners and COPs. Our next photo will have the implementing partners and COPs. May we ask you to come forward, please? But may we please ask our distinguished Secretary Urbosa and our mayors to stay on stage, please, for the photo, together with USAID. May we ask our main photo group to please stay on stage. Secretary Urbosa, the USAID group, and mayors Belmonte, Petilla, and Mario. Apologies, we still have a few more batches to go. Konti na lang po. Kayo po yung main group, and then we'll be asking different batches to come to join the photos with our Secretary of Health and our mayors. So this photo is with the implementing partners and chiefs of parties. After this, may we ask the guests from NCR to get ready. We'll have the next photo with guests from the NCR region. Okay, may we ask our main, we can work on the next batch. May we ask our secretary and mayors to stay on stage and USAID. We call on guests from the NCR region for the next batch of photos. Guests from the NCR region first. After that, guests from the rest of Luzon, and then the Visayas, and then Mindanao. So we will start with guests from NCR. May we call on guests from Luzon for the next batch of photos, please? Guests from the rest of the Luzon region for the next photo, followed by guests from Visayas and Mindanao. May we call on the guests from Visayas and Mindanao for the next batch of photos together. And may we ask everyone to remain because we will be taking one big groupie together after. Okay, next, find our picture. Next group is the group from Visayas and Mindanao in one photo, please. representatives, our guests from Visayas and Mindanao. For the last photo, please, with our group on stage. All right, may we ask everyone to prepare for the big groovy? If everyone can get back to the center on their seats. Wow. Or whoever. May we ask everyone to go back to the center. We will attempt to take a big groovy together. So after this last photo on the stage, may we ask everyone to make their way towards the seats, and a photographer will be taking a picture from the stage with all the guests. So whoever is there, our last big attempt for a groovy, please, before we go on to our surprise. So this is not over yet. The program is not over. All right, everybody, can we ask everyone to go to the center again, towards your seats or in the front of the seats, and we will take one big groovy. May we ask everyone to go to the center. Center, if you want to be part of the groovy. If you're not in the groovy, you are not here. Joke lang. Okay, we'll try to do this quickly so that we can end the program. Can we ask everyone, please, to make their way to the center for the groovy? All right? All right, so that does it for the photos. Thank you, everyone. Now, our final surprise to cap off our festivities. This is the official opening of our gallery showcasing USAID's health projects implemented from 2018 to 2024. May we invite all our guests to proceed towards the back of our hall, please, for our ribbon cutting ceremony. We'll see you at the back of the hall. Okay, welcome back everyone. Before we may we officially start the ribbon cutting ceremony. We have with us here Secretary Herbosa, Mayor Belmonte, Mayor Petilla, Mayor Merillo. We have and other USAID. All right, one photo before the official cutting. All right, 3, 2, 1. Congratulations, our gallery is officially open. All right, our gallery is officially open. Please enjoy the exhibit as you discover and learn more about the outstanding initiatives and achievements of USAID's health projects. This has been PADAYON-The DOH USAID Shared Journey Towards a Healthy Pilipinas. Maraming salamat at sama-sama para sa iisang Healthy Pilipinas. PADAYON!